Okay. So I come into the room, introduce myself, ask for 2 patient identifications. So what is your name? And your date of birth?
12/5/95.
Thank you. And then I'm going to come in and I'm going to begin the assessment by inspecting the thorax. So first and foremost, the AP to transverse ratio is 2-to-1. There's no barrel chest. Oh, by the way, side note, obviously this would be done without a shirt on, but it's being done with a shirt on right now. I do not observe any cyanosis, no blowing of the skin. And I'm also going to begin by asking subjective questions. So, first and foremost, do you have a cough?
No.
Any shortness of breath?
No.
Any chest pain with breathing?
No.
Any past history of lung disease?
No.
Have you ever smoked cigarettes?
No.
Do you live or work in conditions that affect your breathing?
No.
And to your knowledge, when was the last time you had a tuberculosis skin test?
Don't know.
Or a chest radiography?
Don't know.
Or the flu vaccine?
January.
Okay. Now I'm going to palpate side to side and down, noting any pain or tenderness, and I'm also going to be feeling for any masses or crepitus. So, side to side, down, side to side, down. Feel any pain?
No.
All right. The patient does not feel any pain. I did not feel any masses or crepitus. Now I'm going to check for tactile firmness. Can you say the word blue moon?
Blue moon. Blue moon. Blue moon. Blue moon. Blue moon.
Okay. I did not feel any tactile firmness. And percussions. Okay. So I'm going to percuss in the intercostal spaces, holding my hand laterally. Side to side, down and down, starting at the apices. Oops, sorry. Okay, actually, I'm going to pause for a second. I can do this. Question. When I am percussing a female, how do I put this? How exactly do you properly percuss the whole area? Because I'm genuinely wondering. Let's see. Now that awkward question's out of the moment. Okay, now I'm going to move on to auscultating the anterior portion of the thorax. All right, so I'm going to ask you to take a deep breath and hold on. And again, this would be done with no shirt in a regular setting. Go ahead, take a deep breath. Okay. And I'm going to ask you to please turn around. We're going to repeat the IPPA process posteriorly. All right, first I'm going to inspect the posterior portion of the thorax. I'm going to be looking to make sure that the shoulders are symmetrical, and they do appear to be symmetrical. I'm also going to observe the vertebral column, make sure that it's straight and in a central line running down the back. And now I'm going to palpate the same way I did anteriorly, side to side and down, and note any masses, any tenderness, any crepitus. All right, side, starting at the ABC side, to side, and down. Let me know if you feel any pain. Any pain? Okay. All right, the patient feels no pain. Upon palpation, I do not feel any masses or crepitus. All right, can you please say blue moon?
Blue, 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 blue.
Okay, thank you. All right, and now I'm going to move down to T9, around T9, T10 vertebrae. I'm going to ask the patient to take a breath, and I'm going to be checking for symmetrical bilateral lung expansion. All right, go ahead and take a breath. One more time. All right, thank you. All right, patient exhibits bilateral expansion of the lungs as evidenced by when the patient takes a breath, like a butterfly, the wings move out and move in with inhalation and exhalation. Okay, and now I'm going to percuss the intercostal spaces, checking for any abnormal sounds. Normal sounds over normal lung fields should be demonstrating resonance. And again, moving side to side and down. Okay. Okay. The sound observed was resonance. Okay, now I'm going to auscultate. I'm going to listen for breath sounds posteriorly. All right, please take a deep breath. Okay, thank you. All right, I did not observe any adventitious sounds. Lung sounds are vesicular and clear in all fields. And that completes the respiratory exam. And again, my question essentially was, with a female, what are the exact areas that you would palpate for an exam, and also percuss? And that's really my only questions for this. And that completes the exam. I would ask the patient if she has any questions, or if there's any other reason that she's seeking consultation. And that is it. So, yep, that's my only questions. And thank you very much. And I hope you guys are safe and healthy. Have a good night. Bye-bye.